Hello, everyone, and welcome to a Saturday live stream. We're doing things a little bit differently today because we have a very special guest. If you watch the channel a lot, we have Melody, who is on here all the time, gracing us with her beautiful presence. We're going to be talking about chronic healthcare conditions. So, this is something that we see all the time in healthcare, right? And it would almost make sense that we would be good at dealing with it because what is healthcare if it's not chronic care management? We kind of split into two tanks, right? We have acute care management, which is like, oh, I broke my bone, let's fix it. And then chronic, which is something that people are going to be living with in some cases for the rest of their life. And one would think, right? You would think that we would be good at this in healthcare, at being like, oh, well, this is a huge chunk of the population that we're dealing with. But as you probably saw by the title in the thumbnail, we're not. And if you are someone that deals with any kind of chronic condition or loves someone with a chronic condition or just sees it, let me know in the chat or the comments, like, do you also see this as a problem? Maybe I've lived under a rock and like I've just seen issues with it. But I know from my nursing perspective and from primary care, this is something that affects a lot of people, and healthcare is really bad at it, right? We don't really know how to talk to people. We don't about it. We don't, so we avoid it, or we don't know how to handle the mental health aspect of it. We don't want to say the wrong thing. We don't even think of the barriers that are there because they don't affect us, right? And these are affecting people everywhere. So today I have a friend, Melody, and she was going to come on and just discuss this from a patient perspective, and not in just a, hey, this is like the hard parts of it, but also introduce some of the hopeful aspects of it from things she's dealt with this for many, many years, and kind of introduce some concepts that she wishes healthcare providers knew. She wishes people knew in general. Like, I wish people knew this about people who are living with a medical condition that's not going to go away. I've gotten a ton of insight from her as a nurse practitioner, like of how I wish I would have handled things differently and spoken about things differently. And so I think this is going to be really helpful for healthcare people or people in general to understand a perspective coming from someone who is living in this, of things that, we didn't learn about and we might not think about, that will make our care a little bit more compassionate and well-rounded. And then if you are someone living with a chronic condition, hopefully give you just feel like, okay, yes, I'm not the only one feeling this, right? Because there's huge power in feeling like I'm not alone here. But also there are paths forward, and it's not just, here's the one way that we have to do. I have to do it this way, and this is how it's going to be. Like, that you can find some type of, you can navigate it and you can take charge of it yourself. And so that is what we're going to be talking about today. Oops, I didn't spell that right. I was trying to text and speak at the same time. So if you're brand new here, I'm Liz. I'm a family nurse practitioner, but the main person we're going to be speaking with today is going to be Melody, and I'm going to bring her in right now so she can introduce herself. And you're jamming out, and I love it.
I'm Melody, and one of my passions is music therapy, and I am listening to My Life by Billy Joel, because whether or not you have a chronic illness, it is your life, and you've got choices, and that's what this stream is about.
Woot woot. Also, note from the top of it, if you do get value out of the stream, make sure to like it, because we are going to be playing lots of music in here. So we can't monetize it because YouTube says no. And I'm not worried about the monetization side of it, but if YouTube can't put ads on something, they don't promote it. So you have to like it more than you normally do to promote it, or comment on it, or engage with it. So there's my shameless plug. But I'm going to hand it over to you to introduce yourself.
Okay. All right. So I'm Melody, and I'm extremely honored to be here, whether it's on the panel or just now with Liz. And I just am hoping to provide a perspective to help someone, whether you're suffering yourself from an illness, whether you're a student, whether you're a caregiver. Basically, if you have a heartbeat, there is something in this stream for you. So Liz and I collaborated a little bit on how to present this video. And Liz, would you like to tell them about the thumbnail?
Oh, yes. Okay. So the thing that we kind of named it with the thumbnail is, this is, I think, a big forgotten type of, like, we kind of forget this. Like, we see you when you come into the office, a lot of like people with chronic conditions, and then we just kind of like forget, to be totally honest, like that, we'll see you every couple of months. And in my perspective, what I've heard from a lot of patients is like, you see me here and there, and then you kind of forget, and I'm in this huge sinking hole, and then you come back. And I was kind of presenting it from that perspective. And Melody actually came back and challenged me, and I thought it was really good. She's like, but I want to show some hope, right? Because I was was like, oh, this is awful. But she came up with the idea of like, you can kind of pick your roads, right? You can kind of pick the traditional route that like, okay, we're going to shove all of this at you. And this is like, medicine typically presents it in a way that's like, this is your only path forward. And one of the big things that she wanted to talk about today, and that I'm grateful she did, because again, my doom and gloom takes over, is that there are other ways forward. And this isn't, it's difficult, and nothing is going to make chronic care and chronic living with chronic conditions like not difficult, but there are ways to navigate it. And so that's a huge focus that we wanted to have today. And Mel, it doesn't take over the chat, my dear. Go for it. She said, she's like, she's like, I have so much passion about this. Show me if I'm taking over the chat. Go for it. Go for it. And we've seen Nurse Scott. Hello, Nurse Scott. Who said Kate? Nurse Corky. I know all of our regulars. Thank you for being here, everyone. Yes. Very much appreciate you. And Interpret, thank you so much for the super sticker. I so appreciate it. And we'll be taking some questions at the end. And kind of, so we focus the conversation on this, and then we'll be doing like some questions later. All right. So Melody, do you want to just start us off by kind of explaining where you're coming from with this chronic disability for people who are not like even, it's not really on your radar of what it is, where that's coming from, and just kind of introduce the topic and your wonderful cat.
This is Raymond. Everybody loves Raymond.
Oh my God, I love it.
Okay. I knew that would happen eventually, but not so quickly. Okay, well, I am now 52, and I was deemed legally disabled at 22. So this has been the majority of my life. And it has been a constant road of accumulating diagnosis after diagnosis and treatment after treatment, both medically and from a mental health standpoint. And my approach to it has varied over the years. And I've been at times the perfect patient. A few years ago, I basically said, you know what? This isn't working. F this. And I went into my doctor and I said, okay, I'm here because my other doctor retired and I have to have a primary care and I may need you, but I don't want any tests. I don't want any diagnoses. I don't want any therapies. Just do my exam and write down what you have to do so that I'm in your chart, and leave me alone. And I had a note from the person who would be my power of attorney at the time saying, we understand the risks of all this, and we will call upon you if she changes her mind, but please don't pressure her. And the doctor was kind of like, okay, because like I said, she was a new doctor. So can you imagine, this is your new patient walking in with a file, like, bigger than this. Mm-hmm. And maybe you've actually taken the time to review it if you had it, and you're like, okay, she's complex, and I'm going to remember to address this and this and this and this. And I walk in and she says, what can I do for you? And the patient says, please, nothing.
Please, just no.
Just no. If I need comfort measures, we're going to call you, but otherwise I'm just here for the paperwork.
Yeah.
So anyway, I have varied from having, tons of treatments and everything to gone the complete spectrum. I mean, mm-hmm. My attitude, and I have to give the doctors that are still with me a lot of credit, because it can't be much easier for them than it is for me. But the one thing I am is honest. They never have to wonder if I'm complying or what I'm thinking or what I'm feeling. And
which is the best.
And I feel that that's the best. So
yeah. And do you kind of relate to what Nurse Corky says here and just get tired of like people throwing pills at you for everything?
Yes. Or what worse yet is, well, we've already tried everything, and so you just have to deal with it.
Oh, that's yeah, that's
I'm kind of like, so you're telling me that with all the pills out there and with all the treatments out there and all these commercials that I see and the shelves that are full of everything and this whole pharmacy, that we're out of options. And it's kind of like, well, yes, because you have these allergies and you have these, what do you call them? Comorbid conditions. And you have these things, these medicines will, you have to have these. And if we give you those, they'll interfere with that one. And even right now, I'm in a position where it was last week or the week before, I lose track, where I got a new diagnosis and they were like, okay, there's only one treatment for this. It's an infusion. I'm already on 2 types of infusions. And then they're like, but we don't offer it in town. So you're going to have to go out of town. And then I researched the infusion and it said it's contraindicated for people with X, Y, and Z, like other diagnoses, of which I had all of them. And I'm sitting here going, okay, so you're telling me the only treatment for this condition for which I have to go out of town when I don't drive is contraindicated and is going to hurt these other conditions for which I'm currently being treated. And that's kind of a point at which I'm like, okay, this merry-go-round has to stop. Let's listen to Billy Joel.
Yeah. And I think that brings up a good point of the initial one of like, it's hard for other people to imagine that like they see their one thing, right? So you come to me, I'm your cardiologist. I see your heart. I'm like, well, why can't you go to this appointment? You're like, well, you're completely missing the fact that I'm also on like dialysis. So my appointments have to be on Tuesdays or Thursdays. I also need transportation that's going to be here, but now I'm going to be on these meds and this can't back up in my, like, you just see such a narrow thing. And that has just got to be exhausting to deal with, of people like assume, like coming from the background of like, oh, of course this isn't going to be a problem. And it's like, oh my gosh, you just have no idea. Absolutely no idea.
Right. So yeah, I think that one of the things that's, I guess I have an outline here, but we're not going to go in order. That's already been tossed out the window.
We made it 10 minutes with one. It's fine.
In terms of discussions between providers and patients and what to do and not to do, Nurse Liz just pointed out a really good one, which is that even if you are a specialist, and obviously there's a reason that I'm coming to you, which is to treat that specialty, that you please need to take into consideration that there is more going on with me than your specialty. Because otherwise you could literally prescribe a treatment that is going to harm me just because you didn't look to see what else is going on. And that's where collaboration among all of you is so important, yet so difficult in terms of time and coordination and everything. And where advocacy of the patient is so important, to be aware of what's happening and to look these things up and kind of go like, by the way, I'm not sure this is a good idea, On the other hand, it gets really confusing when you're like, but Dr. So-and-so told me to, and it's like, all I was doing was following directions.
Yeah. Because we don't think about other things a lot. We're like, oh, well, this is my silo, so we're going to do this. And we've talked in other streams about like, there needs to be a lot more interdisciplinary like conversations where you get everyone together and you're like, hey, this is like the big picture. You're looking at the corner of the painting and there's a lot more happening here, my friends, than just that corner of the painting. Do you have any tips for like helping navigate that when you run into that situation with providers?
I have things you can try.
We're all ears.
Okay, so one thing is with each of your providers is to have a discussion and have a mutual agreement. What is the best way for me to contact you if I have a concern and I can't wait 4 months for an appointment? Do you prefer a phone call? Do you prefer that I talk to the nurse first? Or do you prefer, like most of mine do, because to go through the portal if you have that available to you, like an email system? And for me and the specialist, that works best because we've kind of found that conversations with the nurses are a waste of time because they're kind of like, oh, that came out completely wrong. Just because all the nurses are like, well, I need to consult the doctor.
Yeah.
Not because the nurse doesn't know or doesn't deserve to be involved in the treatment. Let me make that clear. Nurses are heroes. But just for the purposes of those specific questions, it's always like, I could have just written to the doctor and she could have just written to me back and you could have been with the patient during that time that you were retyping my question, So that was out of respect, not the opposite. Um,
We appreciate it.
so a lot of what I try to do is, and this is very time consuming. By the way, having a chronic illness is a full-time job.
Mhm.
If you have a friend or a family member or something, I used to get all the time, well, I don't understand why you're so tired. You don't do anything.
Oh,
Well, number one, I have 15 illnesses, and number two, I do have a job.
yeah.
Because if you look at how many emails I have sent today and how many phone calls I have made today and compare them to how many you have made, they're probably about the same. Just so you know.
Yeah. And that goes back to when we had talked and you said something about it being invisible. You know what I
Yes.
mean? Like healthcare is really good at fixing really visible problems. I feel like we're like, oh, let's do this x-ray. Oh, your appendix is exploding. We can fix that. Here you go. And on the other hand, it's like everyone who has, if you have a lot of chronic things, you can't necessarily see that from the outside and we don't know what to do. And we're like, oh, well, this is not like a one shop, like fix quick thing. It's
Right.
yeah.
Yeah. So anyway, to answer your question, since I went off on a tangent because I have thoughts, many thoughts, is I will write. I'll summarize everything. I'll write like to my primary care provider, and I'll be like, okay, I followed up with so and so on such and such a date. This is what he said. This seems to contradict what so and so said on such and such, and I'll write a summary, and then I just copy them all on it.
Yeah.
All the specialists, you know,
Yeah.
and then I request they talk to each other. Usually they don't. They all just get back to me, and we have an endless discussion of me saying, okay, this is what so-and-so said, quote, da, 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 but I facilitate the discussion that way.
Yeah.
But I'm very fortunate that they do respond, and I appreciate that, because I have friends who have providers that they will send them a message and it takes them like a week to get back to them or more. And mine, it says, to expect about 48 hours, but usually it's the same day or less than 24. My primary care, I usually get a response like at 9 p.m. Like, I guess she's gone home, put her kids to bed or whatever. And then it's like, okay, let's deal with people like Melody,
Well, not even that. That's when you sit down and you do all of your charting and all of that type of stuff. That is the life of primary care. And that is why I'm no longer there.
Right.
I could not.
So defining the method of communication, and then basically just taking responsibility for making sure that everybody knows what you want them to know. Because even if sometimes I feel like, well, you should know, you should have read so-and-so's note or whatever. I just take responsibility and just make sure that it happens, because the providers are busy. You've got a million patients, you've got whatever. And so I think sometimes kind of a pain in the you-know-what, but I'm really doing it in an effort to be helpful so that it's all right there.
And it is helpful because so many things can fall through the cracks. Like your healthcare the best, and as crappy as it is, like I wish we lived in a system where like healthcare providers had enough time to look at everything and we could do this, but like you almost need someone who's like tenacious and like that, and be like, I'm going to fight for this. And like, this is the new, these are the new things. And like you said, I think documenting it is so helpful, because then you can just hand it and be like, hey, this is what happened. And then you should have a care provider who then takes the time to look at that. And if they don't, like, you need to find a new one, because that's just not like, they should at least care enough if you're doing all of that effort to go forward and incorporate that into it and be like, okay, what has changed? Where are we going? And like, you can ask, like, do you ever find you tell them, like, you discuss like what the next step is, if that makes sense? Like, hey, and then they said that if this doesn't work, then we're going to go this way. Because I always found that invaluable when my patients were like, and here's the care of like the plan of care. And I was like, well, that's amazing.
My experience with that is I'm usually disappointed. What I usually hear is, well, let's try this and hope it works. And then we'll deal with it later if we have to, or, well, I'll defer to specialist so-and-so on that one, because I don't know. Because with most of my conditions, I'm at the quote treatment of last resort anyway. And so that question just kind of brings us back to the, a whole other topic, which I'm hoping we'll get to, which is what do you do when you really are out of options?
Yeah.
You
Yeah. And I
know?
think definitely, I definitely want to touch on that and kind of throughout the whole conversation, working through mental health, nursing student Carrie. Thanks for being a channel member. I appreciate you. It brings up a good point of like, you don't do anything, therefore your value as a human is like nothing. Like, so what you do in life when people are like, oh, well, what do you do all day? That your value, like we view what you produce very much as who you are. And so, which is, I think, very messed up and especially affects people with chronic conditions, chronic pain, chronic anything where it's going to like Melody, you would like have you have to go to appointments all the time. Like all the time. When we were trying to figure out a time to schedule this stream, she's like, well, I have this and I have this. And then on these days, I was like, oh my gosh, like that is exhausting. And I think I agree with Nurse Scott that you like the emotional toll of that, trying to get to therapy, like, and having something to work through that. And I'm sure Mel is going to talk on that at some point, because it's not just like Alice said, it's not just like chilling in bed all day. I don't chill in bed all day. The 2 days I am in bed, I wish I was anywhere in bed, but able to do the things. You know what I mean? Like, it's
Yes,
not.
I completely agree. And I think that these comments are very valuable and something that I recently addressed on a broadcast that I was fortunate enough to be on, which is that the stereotype politically of the disabled person is we don't want to do anything. We want everything handed to us, and everything is handed to us. And we're just sitting at home on the couch watching TV contentedly while the rest of you go out and work and support us. And in my experience, the majority of people, regardless of age, with chronic conditions are actually highly intelligent and very driven people. And the last thing that we want is to have to be bedbound or sitting on the couch or to isolate for me for autoimmune reasons or whatever. And so that's all a whole other issue of acceptance. And then how do you design a life that is somewhat meaningful when you have this condition that that really goes against the grain of who you are.
Yeah. And you were like, especially like you're so young when you started dealing with this.
Mm-hmm.
Like, obviously, you weren't 20 something and being like, you know what? I am actually going to do all of this work to go through my education, to do all of these things so that I will then have to be unable to do the things that I actually clearly obviously wanted to do. Do you mind going into it all, like kind of what it was like getting a like being in the position of having a chronic disease at such a young age? Because typically, you know, we like a lot of the times we associate this like people who are like, oh, I have this chronic illness when you're older, right? But it affects so many people, like whether it's pain or like Crohn's disease or you know, cancer that we're just kind of keeping in this like stage 4 limbo, or rheumatoid arthritis. Like there are so many things that affect people, and we just, because it's invisible most of the time, we just don't even know that people are dealing with this. Would you mind talking on that a little, of just like what it was like being so young when you started dealing with this?
Yes, it was very hard because, like I said, I'm a driven person. I wanted to do several things. I was an accomplished pianist, and I was considering applying to Juilliard to be a classical pianist. I also, however, wanted to be a lawyer and go out and put all the bad guys in prison, and and did at one point complete a year of law school. I also wanted to be a therapist, and I was voted most likely to become a senator. So, you know, I had a lot going on in my mind, and instead, I was always at the doctors and going, "Why do I feel like this? What is wrong with me?" And so it was a very gradual. I was in total denial. I'll put it to you this way. I was just kind of like, okay, well, and unfortunately I had a, how can I put it? The primary people in my life when I was younger didn't give me the care that I need and just said, you're exaggerating everything because you want attention. And
it's all in your head.
And so that made me feel very self-conscious and badly about going into the doctor and actually finding out what was wrong to solve the problems, because part of me thought that I didn't really have any, because that's the message that I grew up with. And so I kept continually trying to work and to take jobs. And I had a wonderful job that I loved at this California State Board of Control in legislation and policy. And then that's when my disability really said to me, hello, because one day I was at work and I started seeing black spots.
No.
And I was like, what is going on here? And so, I mean, this makes no sense, but neither does seeing black spots. So I went into the bathroom and I rinsed out my contact lenses, and the spots started getting bigger. And I said to my boss, I think something is wrong. Can you bring me to the ER? And by the time we got there, I was completely blind in both eyes.
Oh my gosh.
And so that's for me when I was like, okay, this is not in my head. I can't just push through this because I can't see. I can't just fake it till I make it at work.
Yeah.
Because I can't see.
Yeah.
So that's just an example of like sometimes something really, how they're saying, how it's said a lot of times with people with addiction problems that they have to hit rock bottom before they realize that, okay, I really have a problem.
Yep.
For me, it was the same thing. Something so dramatic had to happen to force me to stop trying to do all these things. And I was always just like never able to maintain a job because of a variety of symptoms, and always feeling like a failure. And that was kind of the worst part of it, was always feeling like a failure. And so it was a gradual process of literally having to get to the point of not being able to do things no matter how hard I tried, that forced me to come to an acceptance. And over the years, those limitations just kind of increased, just one after another, after another. Another challenge with having this all happen so young is is when you're that age, my friends were all graduating from college, getting their jobs, moving away, having long-term relationships, making, plans to get married, family planning. Everybody was going through a transition.
Yeah.
And I got left behind.
Oh.
And so when I tried to maintain my friendships, everyone's talking about everything new that's going on and the new job they got and the guy that they met or this new hobby or whatever it is. And when it's my turn to talk, it's kind of like, well, I got a new specialist last week.
Yeah. And that's not even on their radar. They're like, what? Like, I don't even have a doctor. Like, most people in their 20s, like, that's just not.
Yeah. So trying to maintain those relationships, which I know a lot of them fall by the wayside anyway, just due to the different stages of life, but was extra challenging. And then on top of that, instead of finding a niche and creating new relationships in the work field or in a couple's social group or whatever, I was just left dealing with all this. And the few people left in my life, one thing, and it haunts me to this day, was, you should talk about your illness a lot. And I'm like, and she said, my other friends, they tell me about their families and their jobs and what they did last weekend. And I said, I would love to tell you those things, but I don't have those things. I'm only telling you what I know. And that made me feel guilty and like a complainer. And so I had to, what I had to learn was that it's not all about me. You probably didn't expect me to say that.
No.
Yes.
Just like, cause it should like you. Ooh, yeah.
That's what I had to learn, because it's not. You're dealing with other people. If they have been tolerant enough to remain in your life, they're grieving the person that you were just as much as you are. And they're having to redefine the relationship just like you are. And you don't want to get into a parent-child relationship or a caregiver-client relationship. But then what are you? Because we're no longer coworkers. We're no longer on the same bowling league. We're no longer in the orchestra together. Yeah. And I try to talk to you, and we don't have very much in common anymore. But I love you, and I want to be in your life. And so what do I do? Yeah. And so it's been very important in my learning process, in trying to maintain the relationships, few that I have, or build new ones, to remember it's not about me. Yeah, I need to educate people on what I'm going through so that they have realistic expectations and everything. But frankly, everyone should do that anyway. Yeah. I mean, you've got a full-time job, because the other thing I get is, well, Melody, you don't do anything, but I have a job and a husband and 2 kids and blah, blah, blah. And you have no idea what it's like to be me. And I'm like, you're right. So tell me, and then I'll tell you what it's like to be me, And so it's very, very important to express interest in what the other person is doing, as opposed to resenting it, because sometimes it's hard in the beginning.
That's got to be so hard. I was going to say, that's got to be so hard, especially if you wanted those things. Like when you were 20 and you imagined, like, here's what things will look like at 35. And that's not what things look like at 20, like and coming to grips with that, like, has just got to be so difficult.
Right. But it's like, I still have a responsibility. It's not just that everybody has a responsibility to be my friend. I still have a responsibility to hold up my end of the friendship. And that means that I'm going to be there for you the best that I can, and maybe in different ways than I used to, or in different ways than other people are. But in order to do that, when I can, I need to listen to you, and I need to be interested. I need to be able to put aside my jealousy and be happy for you. I need to understand that when you are sad, that you are sad, and not be like, well, if you knew what it felt like to be me, I don't like it when people undermine my feelings, so I don't want to undermine theirs either. And so I'm very conscientious of the fact that, chronic illness or not, that we have a responsibility to listen to each other and to explain our limitations and our boundaries to each other. And that if things need to change, to address them. Because one thing that people fall into is, oh my gosh, you're sick. And so then they become mentally the caregiver. And then they're like, yes, you can tell me anything, anytime. And then they get overloaded and they get burdened. And they're like, all you do is complain. I'm getting nothing out of this relationship. And then they leave. So it's like you have to work really hard to create a balance in the relationship, and just to have the real open discussions, like, are you comfortable with me talking about this aspect of my medical care? I mean, maybe there's things in your personal life that I'm not comfortable talking about either.
Yeah. And just setting the boundary of it.
Right. It's not necessarily unique to me. It's just, it's not all about me.
Yeah. Which is an excellent life lesson for everyone, but very hard. I just can imagine that would be really difficult to like then reach out. And I know I probably selfishly wouldn't want to hear about other things. You know what I mean? Like, oh, you're living what I kind of wanted. Like, that's what I imagined in my life. And I think from like the outside perspective too, I think that's really insightful, just to remind people that like, this is your full-time job. So like, while we talk about our jobs all the time or our family, like managing a chronic illness is like a full-time job. So of course people are going to talk about that, like And so if people are bringing it up all the time, it's because it's the biggest thing that affects your life. Maybe I complain about my toddlers the most because that's what affects my life the most. And no one thinks that's weird. You know what I mean? But all of a sudden, when it's like a healthcare condition, then we think it's really weird that all you want to talk about is like, your back pain. And we're like, oh my gosh, like, but that dictates everything you do in your life. And Alice said, when you're young, everyone's getting married and having babies and getting houses, and you're stuck going doctor to doctor. And the one time you do go see friends, you have to make sure to plan it out, which is also mentally exhausting. Is this accessible? Can I get to the bathroom? What am I going to do when I have to do this? And I think that's something that I know I've definitely forgotten too when I have like patients. I'm like, well, can't you ever get out? Like, you know what I mean? Like, can you ever go and do something? And I'm not thinking about, oh yeah, you have to plan, like, where am I going to go to the bathroom? Where am I going to do this? What's my backup plan here? Like, and that's mentally exhausting on top of like mentally exhausting. Like, it's not that simple. And we had kind of talked a little bit about what were some boundary setting things that you found helpful, like with friends, in order to plan ahead, like, hey, I do want to hang out, but kind of setting like realistic, what are we going to do here in terms of friendship type things?
So basically, again, to not make it all about me, like, I'm going to tell you what's going on with me, and I also want to know what's going on with you that could interfere with our plans, so that there's a mutual respect there, that we do have other things going on. Not that we're not priorities, but that your child could get sick. I may not be able to get out of bed. So conversations to have are like, okay, so how flexible can you be? If we need to change the time, will that work for you? Would it need to be earlier or later? Like, particularly if you have children or something like that. If I can't, which I can't anymore, but when it was relevant, if I can't go out, is it okay with you if we just hang out at my house instead? I'm sorry, you're the one that has to be the one to travel. I'll pitch in for the gas. Can we make that kind of accommodation? At what point, if I'm not feeling well, do you want to know that this may not work? Do you want to know that morning, or are you okay waiting to confirm until an hour before? Do you want to make a backup plan so that if I can't do this, that you don't feel completely let down and like you wasted your day off? And all those things need to also come back to me, because when I make those plans, if I am well enough for it, and then something comes up and it gets canceled, I am devastated. So I need to have responsibility for that too, and be like, okay, so we're going to confirm at such and such a time. And if that doesn't work, if it's not going to work for you, then that's when you need to let me know, because that's when I'm going to my plan B. Mm-hmm. And both have the freedom to do that. Mm-hmm. Did that make sense? It's
not personal. Yeah, it's not personal. And that makes it much more intentional and not last minute, like, oh, well, all of a sudden I can't do this, because I think a lot of this is just coming down to communication. Yes. You know what I mean? Communication with the people that your friends, communication with your loved one, communication with a healthcare team of this is working, this isn't working, and having those conversations, which can be really uncomfortable sometimes, to be like, hey, like, this is what this is. But so needed, and can help a little bit. And I'm glad, nursing student Carrie, when I go out with my friends, I start by asking if there's dietary restrictions. I never thought to ask about accessibility. This is so informational. So it's super duper helpful. And again, thank you for Melody for doing this with us.
My pleasure.
We appreciate you.
So I was going to say, I don't know, 5 things. There was something about, give me a second.
No, you're fine.
Oh, yes. So having something to talk about besides your illness, because it's important to have even though it is my life and it does govern how I have to run my life, I don't want it to be my whole identity, because frankly, that bores me just as much as it bores, the next person. So to be able to, even if it's something simple like, hey, this song, I could totally relate it to the lyrics of this song, and then send it to the person and talk about it, or play it when you're together and talk about it. Or I read this book, or just whatever it is. And I know that a lot of people rely on support groups to meet people and build their support system. I personally, I like informational groups, educational groups to understand what's going on. But when it comes down to building relationships, I like to bond over something other than my illness, because that helps to broaden my world.
Mm-hmm. Yeah. And making I think that's huge. And asking people from a provider standpoint, kind of asking people, what are your hobbies? What are your interests? And even introducing different, that's when getting involved with I don't know, just helping. I've made lots of suggestions to a lot of here are things that maybe you would be interested in trying, little things like that of what could we do? Because you're more than just, you are not a Crohn's disease. You are a human who happens to have a gut that is really angry at them, and not defining it and wrapping it all up in that. So one of the things I really wanted to touch on was tips, tangible tips that we can kind of give healthcare providers if they're watching this, anyone in the healthcare space, of things that we do that we could do a lot better from the perspective of someone who has interacted with this system a whole lot. And we talked about one of the simple things. I'm going to paraphrase some of it, and then you just tell me if I'm on the right track somewhat, and then we'll add your notes surrounding it. Does that work?
Absolutely.
Perfect. So one of the big things that Melody had said, she was when it's annoying when you have your whole medical history and it's all laid out and you go in and it doesn't appear that anyone has read it before they go into a room. They come in and say you have had a hysterectomy. So that's when we remove your uterus. And then they come in and are okay, so when was your last period? But obviously you wouldn't have a period if you didn't have, we took all of that out. Say you've had everything, your ovaries, all of the things taken out. So just taking a moment to internalize, actually read through and actually internalize it, because what if it was a traumatic situation surrounding
mine, which I've shared.
Yes. So Melody had a hysterectomy, but it was an emergency type of thing. It was not something that was planned. It has a lot of trauma surrounding it, because it has so many implications surrounding childbearing and just kind of everything. Right. And so that's pretty traumatic if every single time you go into a room, then they're oh, when was your last period? Or could you be pregnant? Could you have that? You know what I mean? Every time you're in the ER, things like that, where it's just bringing up a lot of past things that it's just take a minute. If you just took a minute and really read it, that's when people have amputations and we're oh, how are your toes? And you're oh my gosh, you know what I mean? Things like that, because you aren't thinking about it. You're just briefly going through it. So taking a moment and really understanding it, looking at family history. Melody was saying that she, if you come from, you don't know your family history, right? Whether you're adopted, or
foster care.
Yeah. And a lot of the time, and you ask about it, it's just come on.
Friend. Every time.
Yeah.
Every time. I'm
how frustrating that
how long
is.
have I been your patient? I don't know.
Mm-hmm. And it just shows that you're not really paying attention. You don't really care. You're trying to just zip through it. And I think those are really easy things that we can look at and fix. Just take a minute to read it and really think about it. Don't just be oh, hysterectomy. Be what are the implications of this? Okay, perfect. I can do a little bit better surrounding this. And then the other thing we had talked about from a provider standpoint was looking at how everything mixes, right? Because if you have someone who's on a lot of different medicines, or if it's chronic pain, going into how does all of this interact with your ability to live your life in terms of driving? Okay, so if you can't drive, how are you going to get groceries? How are you going to do X, Y, and Z? How does this all play together? Should you be driving? Is that a conversation you need to be having? Hey, you cannot be taking all of this, my friend. And then driving around town, doing all of those, and really looking at it as a big picture life thing, not how am I going to keep you functioning and for the next 3 months, but how is your life going to function? You know what I mean? Taking a step back, and things like that. Does that make sense? Did I describe that in
Absolutely.
a decent way?
And the driving one is a big one. That has probably been the thing that has made my life the most complicated, was not being able to drive from such a young age.
Did that happen
And
immediately? Like pretty much.
well, I went blind. So
Well, I mean, like, when did that come back? Yeah. Well, I went blind,
that
you like
came
tell
back
Liz. Speaking of not
gradually.
understanding what you're saying.
Yes, that came back gradually. I was in the hospital for 3 months on IV steroids.
Oh my
And
gosh.
it came back gradually. My whole body transformed, but I could see. And but I also have visual convergence disorder, so my eyes don't focus together. and
Mm,
and I also have poor depth perception, so even when I could see again, it was not safe for me to drive. And
yeah.
I mean, I stopped driving before anybody told me to.
Yeah.
um but that was a conversation that I wanted to have, and get kind of input and questions, conversation from the providers here, because I know so many people that, be it, that they're wearing a neck brace, or that they're on narcotics, or whatever, that are just driving around, and they're driving to their medical appointments.
Mm-hmm.
And the doctor's not saying, how did you get here? And the
Mm-mm.
pharmacist is like, yeah, here's some more fentanyl that you're on 24/7 through the
Mm-hmm.
drive-through. And
Yeah.
and it infuriates me, and I understand it, and I try to talk to my friends, and I'm like, look, this is like drunk driving. It's like, if you want to put yourself at risk, I don't want you to do that, but now you're involving everyone else on the road, and that's just not okay. Well, my doctor didn't say that I couldn't.
Mm-hmm.
I'm
And
like,
when,
well, what did the little thing warning on the medication bottle say? Well, it's a warning, it's not the law. Well, I know my body. Well, I have a
mm-hmm.
high tolerance. Well, I haven't been in an accident yet. That's like having unprotected sex, and saying, well, I'll never get pregnant because it hasn't happened yet. So I would really like to see physicians and nurses and social workers and everybody stepping up to the plate and saying, okay, I realize this is going to have a humongous impact on your life, and that we're going to have to do some problem solving, even just for you to get the treatment that you need. But
Mm-hmm.
you cannot drive. And if you do, these will be the consequences.
Mm-hmm.
And really, like, have a contract or some sort of accountability thing going on. And don't let them lie to you. Oh, my boyfriend drove me, but he's out in the car. Nah, boyfriend's right next to you right here. I don't know what I would love feedback from the professionals in here. How do you navigate that? Because I am so worried about so many people. And I've done stuff like called pharmacists and been like, my friend is coming to pick up her fentanyl, please don't give it to her because she's on it 24/7 and she shouldn't be driving. And they're like, well, this is none of your business. And actually, it's not ours. As long as the doctor hasn't put in an order saying she can't drive, there's nothing we can do until she gets in an accident and, blah, 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 blah. And I'm just like, I'm at a loss, and I worry about people.
And this was so Melody and I met before this to kind of just like go over. And when she said this, I was like, crap, because this is not something that we really think about. Like, to be totally honest, like from a primary care perspective, like we don't think about that a lot. Like, it really slips under the radar of like, you're kind of like, oh, okay, well, like this is fine. Not often, are you having the thing in your head of like, we need to really have a conversation about you not being able to drive if I'm going to prescribe you this and really go through with it for a long-term situation. And then figuring out, now we need to troubleshoot, hey, how are we going to get you to appointments? How are we going to navigate all of this? And I think that's worth like a whole different discussion of just how do you have those conversations that are really hard, but very needed? Because like you said, it's a public health issue, because you should not be driving around like that. Scott says, under California law, doctors are required to report anyone to the DMV who suffers any medical or mental condition that may impact his or her ability to drive safely. And I just wonder how often that happens. You know what I mean? Because that's not something that is stressed, I will tell you, at least in school for me. I was in practice by the time I had a patient ask me to evaluate the driving ability of a loved one and to take it away, essentially, which was appropriate in that situation. And I literally had really not ever thought of that before. I was like, oh my gosh, like I can do that. I can call the DMV. I can be like, hey, this person can't drive anymore. And like nursing student Carrie said, I feel like it's going to force people not to get medical care because most places don't have functional public transportation. And it causes a nasty mess. A nasty, nasty mess, which I'm sure Melody can attest to. And Alice, like, who has not been able to drive either, like from other, like, it's a hot mess because we don't have a good infrastructure to support it. And, they're going to say your insurance company is going to be like, oh, well, I mean, this is a line that we'll say all the time. Your insurance company has to provide transportation to you. But what does that look like? Does that look like dropping you off at 8 a.m. for an appointment that's at 4?
Right.
And they were like, well, we gave you transportation. And
the one
like,
that we have now here, they won't even confirm if you have a ride until the day of your appointment.
mm-hmm.
Well, you can't function like that as a patient.
Mm-hmm. Yeah. Yeah. Like, and then your healthcare system's going to drop you because they're like, oh, well, you're unreliable.
Right.
And now you've missed 3 appointments. So obviously you're lazy and you don't care about your health. Not the fact that, oh, you have epilepsy and we told you can't drive. Oh, wait. Wait.
Oh, and by the way, Nurse Scott, I am from California, and I just stopped driving voluntarily, and they kept renewing my license automatically all the time. It wasn't until I moved to a different state and I just applied for an ID card that it was taken, that I didn't still have that legal right. No doctor said anything.
Yep. Because you can, fun fact, as a healthcare provider, you can call the DMV and take someone's driver's license away for medical purposes, not because you're mean and evil. You have to provide reasons.
But then please help them problem solve.
Exactly. Please help them problem solve. And
tell them it's going to happen. Don't just do it.
Yes, obviously. Yes. Very much before, hey, this is what we're going to do. This is how this is going to happen. And be that person for people who are in family situations where it sucks. Like it sounds so much better coming from you because you are not related to them. Usually this is people who are on, either a medicine, like they have a condition that won't let them drive or, whatever is happening. It's much easier for you to go and confront the person and say like, hey, for your safety and the safety of everyone else on these roads, like you cannot drive anymore. Be that person so the person doesn't have to take the driver's license away from their loved one. That's just a really miserable situation. And hello, Vanessa. Welcome. How dare you be at work? How dare you? And so I'm really glad you brought that up and we're passionate about it because honestly, it was not something that was ever really even on my radar. And I think a lot of people like, yikes, but that's why we're having these conversations so that we can raise awareness of it and be more aware of it.
I had a friend in that situation and she'll, I'll come over and da-da-da. I said, if something happened, I'm like, when was the last time that you took your, whatever the medicine is? And I'm like, if something happens to you on your way over here, how do you think I'm going to feel? Mm-hmm. And sometimes people are more, I don't mean to make it all about me, but frankly, that's a good strategy sometimes because instead of just saying like, well, you should be more responsible and, because you could hurt yourself and blah, 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 blah. At that point, you're already in so much pain and going through so much stuff that you don't really even care. Or like I said, you haven't gotten in an accident yet. So you're under the illusion that it's never going to happen. If you flip it around and be like, well, okay, but from a practical standpoint, this could happen. And then how am I going to feel? It kind of, whether it's driving or something else, really, mm-hmm. it does help because most of us, this is an instance where I will say it is, like I was saying, it's not all about you, the patient. It's about mm-hmm. the people around you. And sometimes mm-hmm. as patients, we do need to be reminded of that, you know what, it frightens me to see your behavior when you're doing this. It concerns me when this, or, if that were to happen, how do you think that would impact me? And that usually works because the sick people, we don't mean to be like self-absorbed and, selfish or whatever. Sometimes we're just like, look, we're just trying to get by and doing everything we can. And we don't think as to how it really does impact people sometimes.
And a lot of times people don't. And so then you do have to, just point that out and be like, hey, I'm not doing this because I hate you. Like, I know it probably seems like I'm targeting you and I'm taking one more. And I mean, like, from the flip side, that has to feel like you're taking one more thing away.
It does.
Like I only had 5 things and now you have taken one of my freaking 5 things. Like, are you kidding me? Like, so I completely see it from that end, but then explaining it like, hey, this is not, if it was just you, like, you can make that choice for yourself. You're an adult. Like, you get to choose that, but this is going to affect a lot more people than just you. Right. Which kind of goes into the next thing I wanted to sort of talk about was like being able to make decisions about your own care that might go away from the norm or like what your healthcare provider might kind of like want to guide you to, because there's the ways that like there's the guidelines, there's the way that like this is all it's always done. And I think that works really well in the acute care. When you break your bone, this is how we fix it. And here we go. But I wanted to kind of talk with you about like, what if it's when it's chronic and now we're trying to balance quality even at the sake of quantity, because I think we're really bad at that. And we in our like in my mind as success, or in a lot of people, like I know I've been there when I'm like, okay, well, if I can get you, like what I mean, if I can get you 5-10 years, if we can hobble along, and the person's like, I don't like, but what does that actually look like in terms of I can't do the things that I want? Those years are filled with what? Me living at the hospital? Like, what is that? So do you want to kind of expand on that? Any kind of like communication strategies or things you have with like communicating that to your provider that like gently reminds them, or not so gently given the situation, like how you've navigated that and how you think about it? You know what I mean? Like, cause I'm
Yeah.
sure that's changed from when you were 20 something to
Yes.
now where you're like, huh.
Right. Yeah, definitely. I think one of the things that I think is difficult for providers to do, because in doing your job, you are focusing on what is our medical condition, but is to remember that you don't know the totality of our circumstances.
Mm-hmm.
And, that includes our social resources, our familial resources, our financial resources, everything. And, and before I get into decision making, I just want to address an example of this, because I think it's true for many of us, but particularly people who are seniors. But like if you're single, I have had doctors repeatedly say to me, well, don't you have someone who can stay with you? You really shouldn't be alone. And I mean, I don't like to be a jerk, but my comeback to that now is, you're welcome to come over anytime. I'm like, how long have you treated me now? I don't have relatives. I don't have children. I would love to have somebody be with me, but I can't. So then you get into that little, well, maybe I can't live independently anymore. And that is scary as heck. Particularly now. And so it's hard. And I think that people have to be realistic. The person that solved that issue for me at that time, it's got definitely a short, happy life. Was my psychiatrist. And I was crying. I had the best, God bless Dr. Blanco, if you're out there. Anyway, I had the best psychiatrist. And I was complaining about that to him one time. And he said, okay, so why is it that they think that you shouldn't be alone? I said, well, because the doctor said I might fall. And he said, so how is you're not being alone going to keep you from falling if they're not like holding on to you every second? And I was like, well, I don't know. And then I said, well, they were also worried that I was going to stop breathing. And he goes, okay, well, if they're asleep, you're not alone. How are they going to know if you stop breathing? And so he was just really asking like reality testing questions so that I could go back into my doctor and basically say what he said and say, okay, so now what do you think? And what it came down to is, who's going to push the emergency button, me or someone else? I would prefer to have another person available to do it. But if you don't, it's okay. I can still do that.
Yeah.
We have the ones now, the fall alerts. So if you can't push them, then, and they have GPSs on them, so you can go places. And I mean, there are options. And I mean, having to lose your independence is an entirely different discussion that I don't think we can tackle today. But just be careful, because sometimes when you're asking your patients, again, like when we were talking about the hysterectomy, the family history, a simple suggestion of, you really shouldn't be alone for the next 3 days can be extremely triggering for somebody.
Oh, yeah.
Who was in the middle of a divorce, who was trying to get out of a domestic violence situation. Or, I mean, you don't know what's going on. I think I used a word.
Oh, I mean, we're fine. Remember?
Okay.
Yeah.
I just talk. I tell it like it is.
No, I appreciate it. But this one we can be free because we aren't slaves to the YouTube AdSense.
Right. So recently I did have a quality of life discussion with my primary care, and this will fall into a category of someone who I feel did something right in her response.
Yay!
I love to share those. As you know, I do. And so it was a virtual appointment, and basically, because of my conditions, even pre-COVID, I was advised to isolate. I've shared that before. And I did to various extents. And then COVID made it worse. And then even post-COVID, everyone's like, well, no, you're still high risk and whatever. Okay. So we were having a virtual appointment, and I said, I'm not happy. I'm like, you'll make an exception for me to leave my home, for me to go to the hospital for infusions 3 or more times a week, or to come to see you, but not for me to go do something that I love. And that makes no sense to me, And she was like, well, we're just trying to protect you. I said, I understand that. But I said, over the past 3 years, there have been maybe 2 or 3 times when we didn't think I was going to make it. And some of those times, or more, and some of those times the medical professionals agreed with that, and I was in the hospital or not in the hospital. And some of those times were just kind of like internal spiritual experience type things that people give various levels of credence to, but my experience. And I was laying there miserable. I was like, all that I have to look back on now is the fact that I've been laying in bed for 3 years. I didn't have any positive memories to carry me through the pain. I didn't have any connections to help me through it. And I was disappointed every time I woke up. And I'm sorry, but that is no way to live, and it is no way to die. Okay. So I just told my doctor flat out, I'm like, look, I'm not going to be stupid, but I'm taking risks because, I would rather, even just have a month of fun. And then when I'm laying there and it's coming to an end, I'm just thinking with gratitude about how Nurse Liz let me share all this stuff with thousands of people that I couldn't do on my own when that's like been my dream, or something like that. Then just laying there going, I was laying there following doctor's orders, and it got me here.
Yeah.
And so I said to my doctor, I said, I love to sing. I said, I want to go to karaoke. I'm going to karaoke if I can get myself physically out. Because usually by the time, if I get myself ready to go anywhere and I can find anybody to drive me, I'm so tired that it's kind of like, well, never mind. I'm just going to go back. But you never know. And karaoke is great because if you have insomnia, they're still open at 1 a.m. Okay.
There you go. Second wind. You're like, okay.
Right. Exactly. And so I told her, I said, so I want to go back to karaoke. What do you think? And she said, from a medical standpoint, I think it's a horrendous idea. From a humanistic standpoint, I understand. And if something happens, we will deal with it. And I was like, thank you, doctor.
Good.
And I've been 3 times in a couple months.
That's awesome. Has it been excellent?
Yes. It's been awesome. A little sad because I'm not as strong as I was. And so because I happen to be a musician, I can't just do it freely for fun like everybody else can. I'm still
It's like
analyze
a very critiqued vocal
performance,
like performance. Yeah.
and all that. But I am friends with the DJ, and she does a really good job of making everybody sound like a star. And so I, I treasure that, and I often record them and play it for myself and be like, hey,
That's
so
awesome.
it's been a little hard because I used to be able to go several hours at a time, several days a week. And now I'm like, I last 45 minutes and I'm exhausted. So it's kind of showing me I'm having again to adjust my attitude and to be thankful for what I can do instead of comparing it to what I wish I could do. And that's just a constant struggle with just about everything
Yeah, absolutely.
that I do. And the DJ is really nice. She gives me my own microphone, and so that just to try to cut down on the contagion, and I've given her permission to explain that to people if they want to know why I'm getting, special treatment. And we have plans for, if I have some of my spells and I have to lay down so that everybody doesn't panic. And, the bartenders know I don't drink, but they all know if Melody's laying on the floor, it's okay. It's just,
oh, don't mind her. That's fine. That's just Melody.
Exactly.
That's like when you have those patients in the hospital that are like screaming or doing something and you're like, oh no, they're fine. They're fine. Like,
oh, Mel and Melody.
Yeah, that's good old Melody.
We'll have to
She'll wake up eventually and it'll be fine. We'll get
online karaoke parties or something. So that was an instance.
And that is an example of good social support, like making a family type of like you don't have, if you don't, that it's not always family. You know what I mean?
Well, and not only that, but those places they are hard for me because I'm sensitive to noise and sound and light, and a lot of times they're very very loud and very light, but you don't have to make small talk because everybody's just singing, and all you have to do is sing along or focus on the lyrics and clap for everybody, and everybody's just positive, and there's no judgment, and you don't have to explain why you didn't get up until 5 minutes before you got there and you spent the rest of the day in bed or at the hospital or whatever. Nobody knows, nobody cares. You're just there and you're singing,
And I love that you're doing that and you're taking that back over, because I think there can be a lot of fear surrounding it. We're really good at making patients be afraid of everything and not valuing the fact that like doing things is what makes everything worth it. And like mental health, I feel like when people are mentally in a better spot, it's just overall so much better.
You can
know what I mean?
The pain better.
Exactly.
The depression and the pain trigger each other. And it's just an endless cycle, and you got to treat them both. And unfortunately, you can't fix either one of them, but you can keep them from making it worse than it has to be.
So not approaching that with judgment. You know what I mean? Because I've seen a lot of people approach it with a lot of judgment, whether that's like loved ones coming in and being like, you need to tell my sister that she can't do this anymore. And you're like, well, like, but she gets to choose one. And like, she loves that, and they're like, and her, oncologist said, absolutely not. And it's like, well, but like, why are we doing this? Right? At the end of the day, like it's so that we can keep doing things that we enjoy and we love, and that there's a purpose behind it. And it's okay to advocate for that, even if you butt heads with people. And if you meet someone, you had said like, it's not my way or the highway. Like if you run into people with that attitude, they're more worried about like their ego, and their success numbers, and not, hey, like, this is where we're actually going to end up. Like, this is a human. This is not like a test subject. Yes. And I wanted to point out, going like a step backward, I thought this was a good comment by Alice. When you're young, they always assume you have family like parents, and I don't. And it's upsetting to have it rubbed in my face that I don't have any support at family at all.
Exactly.
And I think that was huge to highlight, because we do. We are like, oh, well, like, just go get your family members to go and help you. And if you don't have that, that's incredibly, I would imagine that's just incredibly difficult. Like that, like you said, just rubbing it in your face that like, okay, yes,
it's re-traumatizing.
And I think we can do and you can tell me if I'm wrong, but like a better way to ask those questions as healthcare providers is like, okay, like what is your limitation in being able to do this? Like whether it's like like colonoscopies was a common one from a primary care perspective. You need to have someone with you in the office and then to drive you home from a colonoscopy. So I was like, okay, so what is like, rather than being like, can't you just find someone to drive you? It's like, what's your limitation here? Okay, you don't have someone to go with you. Okay, so how are we going to troubleshoot that? And not just having the answer be like, well, just find someone because like, what? Like
People
off of
have
the
jobs,
street?
people have
Yeah.
lives,
Like,
people have their own relatives to take care of. They have their own health to take care of.
and it's
And
yeah. And I would have
and
so many people who would get embarrassed by it. And they're like, I didn't even tell you like that. I was afraid to tell you I didn't have someone because that's embarrassing. I'm like, it's not embarrassing. That's just like, that's life. And like more people than you know are like, it's not something to be ashamed of. You know what I mean?
right.
Like,
But it does make you feel like a freak. Well, whereas what I do hear from my friends when I go off on this subject is, well, I think the doctors forget too that just because we have spouses or children or parents doesn't mean that those people themselves are local, are available, are competent. So
yep.
they get it from their standpoint too. It's like, well, why can't your sister do it?
Or want to do it because
Right.
that's even more hurtful when you're like, well, why won't your kid drive you? And you're like, what do you have to say? Like, well, because they're an asshole. Like that sucks. Like, you know what I
Right.
mean? Like that brings in, but then it brings also into like, is that their responsibility? You know what I mean? Like they're probably working and
Right.
like doing all of the things. And it might not be because they're a jerk. It might just be because they're a single parent of 3 kids and like they can't like it's complicated. It's not just a simple thing.
It is.
Charles LePage says, what's your opinion on medicine that may shorten your lifespan, but will make that shortened life more comfortable? I'm all for that. I mean,
I'm all
not that I
for
can
that
really
too.
speak on it, but
I figure I suffered enough. And I think that at least in this country, there is such an emphasis put on, oh, you can live to be 108. I don't want to be 108. Thank you
no.
very much. And again, the quantity versus quality.
Sure, no.
And I actually had that discussion with my dear psychiatrist in California a long time ago when we realized that I was going to be on psychiatric medications permanently because every time we tried to take me off of them, it was an absolute disaster. And so he had this conversation and he was like, okay, look, you're young, but you need this, this, and this. This is not good for your liver. This is not good for your pancreas. In 20 years, this is probably what you're going to hear from your physician and what you're going to see in your not x-ray, but whatever they show you, in your tests. You're going to develop problems. So you have a choice, but I'm giving you an informed decision. And he was like, but personally, seeing what you're like without this medication, I don't think you're even going to make it to old age without it. So it was really a no-brainer for me. And just like the consequences of psychiatric medications. And I feel the same way about, pain relievers or anything else. It's hard because sometimes you also have to weigh side effects and like, is the medicine itself causing more distress than the condition is? But I believe the question was specific to comfort, and I am all for comfort measures.
Yeah, for sure.
As long as they're handled responsibly. Don't give them to your patients. Don't give them a fentanyl patch 24/7 and not call the DMV.
Yeah. And I think that plays well into like discussing what kind of a relationship you have with your healthcare team. We talked a little bit about like your communication styles and nailing that down. So like working from both ends, because like from a provider standpoint, you kind of need to figure out with your patients who you're going to be seeing all the time who are living with this, like, what kind of discussions do you want to have? Do they want to know everything? Like, very, like, do you want to know worst case scenario? And then we'll backtrack and be like, so this is what it could, like, what could happen. And then, like, is it someone who wants to cope that way and be like, okay, well, I'm going to expect the worst. And then if I get the best, like, bonus, do I want to have it? I had some patients who just wanted it, they wanted it very sugar coated. And they were like, this is, you know, I want it this way. I don't necessarily need to know all of it, but like, you know, it's going to be what it's going to be. And just having that conversation of what kind of communication would you like to have? And then obviously from a patient perspective, Mel, you can speak, or Morlity, you can speak more to that of like, I just nicknamed you in my brain. It's fine. But like what that is like, you know what I mean? Like how to kind of navigate that end of it so that you can more take control over it in a way.
Yeah, like I said, I if anything, I err on being too open. But one thing, and I've said this before on some of your live streams, is that I always incorporate mental health into my medical health conversations, so that they are, number one, so that to help them get that overall perspective, and number two, so that I can say, and yes, so, you know, I realized that when you gave me that mental health screening today that, you know, 15 red flags went up, and you don't need to worry about it because so-and-so is managing my medication and this is what I'm doing for my treatment. And so now we can focus on us and you don't have to like deal with that. And then that way, if I own it, then they don't come up to their own little conclusions as to what that may or may not mean that could end up undermining the reality of my medical condition.
And understanding too that those two go so hand in hand, especially with any diagnosis that's going to affect you for a long time. There is, I don't know if I've ever met anyone who didn't have a mental health struggle going along it, because how do you mentally cope with that? You know what I mean? And then you can't blame it on one or the other. You can't be like, oh, well, this is your depression talking. It's like, no, these are married, like, because neither of them are going anywhere. You know what I mean? So like, we can't just blame all of this pain on the fact that I'm very depressed. Like we have to actually do something about it, not just blow it off as be like, well, you know, if you just like got up and did something, then, you know, maybe you wouldn't have all this pain. I see that all the time with like fibromyalgia, like pain type of things. They're like, well, if you got up and moved more, and you're like, well, I can't. And then you're just kind of blame it all on the mental health side of things. And we're like, oh, a lot of labels come in of like, oh, you know, people with this, like it's all in their head. Like it's branching off of all of this. And it just gets so messy. So like acknowledging that it can be like, yes, they have depression and they have this. So let's figure out how to like not blame everything on the other one. You know what I mean? Or not blame everything on your physical condition. Like, oh, well, they're not really depressed. They just like are bummed because, you know, they have this X, Y, and Z over here.
I'm stuck on the comfort measures question, if you don't like.
No, that's fine.
Keeps going back there. And this, my opinion on this is probably controversial, but
we like controversy here.
Okay. Okay. So I have an issue with certain comfort measures being reserved only for patients who are deemed terminally ill. Particularly since, you know, people can be on hospice for years. No one knows for sure. And so I've had doctors try to comfort me and say like, okay, well, when it gets this bad, then it's okay, because then we'll be able to, you know, we'll put you in hospice and we'll do whatever and blah, blah, blah. And that was like around the time when I was like, okay, I've had it, and no more treatments and things like that. Right. And then I realized that you can suffer a hell of a lot and not be dying. And I kind of wish that would be acknowledged a little bit.
We're very good in healthcare about torturing people. We do not have nearly enough conversations about like, should we versus could we? I feel like we've advanced so much that now it's all like, oh, well, we can do this, so let's do this. And then really taking a step back and being like, but what's our goal? Like coming back to why can't we just, and
Right.
Tiffany agrees with you. Melody, I agree with what you're saying. It's so right. Nursing student said the book Being Mortal by Atul Gawande is great about the issues of how much to treat. I'll have to add that too.
I will too. It's on audio. And then
I can only also audio. I'll find it.
So another doctor. So we were talking about. I'm sorry that I'm not linear.
It's my ADHD is like keeping up just fine. So
all right.
You're not neurodivergent. I don't know what to tell you, friend.
Well, we were talking about the communication with the providers about maybe going outside your little medical bubble. So
patients have opinions, friends.
Yes,
I know.
So a few years ago, one of my infusions, which is my most important one, really, really was not agreeing with me. And I was having every week I was having to finish the infusion in the ER. That's how traumatic it was. And I was so mad. And I just said, that's it. I'm going off it. And the doctor was like, okay, well then you do realize that you're going to die. And I was like, okay. I mean, really, at that point, I was just kind of like, okay, well, then at least I'm not going to do it here this way, And so I decided to stop. And everyone was against it and was just kind of like, well, she should be having this treatment that's available to her and blah, 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 blah. And I was just like, no. And so I went into the pain management doctor. And she surprised, this is another positive story. She retired, unfortunately. But anyway,
people like that shouldn't be allowed to retire. Be like, no, I'm so sorry.
She looked at me and she goes, because at that point I was like, okay, I've had it. I'm going to karaoke. I don't care, whatever. And I'm not having the infusions and I'm going to eat what I want. And that's just the way it is. And so I went in and she goes, she says, okay, so I read any note that you stopped this particular treatment. And I said, yes. And she goes, just like everyone else, she goes, you do realize that you're probably going to die within a year. And I said, uh-huh. And she was an older woman, tiny little thing. She put her hands on my face like this, she goes, I'm so happy for you.
You're like, that's not what I was expecting.
I burst out laughing. I was like, okay, obviously you get it, but what was your thought process? She goes, I've never seen you sicker and I've never seen you happier.
And you're like, that's someone who gets it.
It wasn't, I have to save you.
Because that's ultimately what your healthcare provider is there for, is to explain your resources that are available to you and explain what that could do and then hand it over and be like, here you are. And I feel like so often we navigate it way too much. We're like, well, here's X, Y, and Z, and you kind of get stuck. And then, I mean, I would imagine from my perspective, I feel like sometimes I just see people that are stuck in this, it's like a river and they're just like, oh my gosh, you're stuck in it and you can't stop and be like, I went off, hello, let me leave. And to have someone who's just like, that's fine. Exit. That's okay.
Yeah. And it's hard. And this kind of brings me to another thing that was somewhere on our outline, which is, as I said, I did have several close calls and that was really hard on the people close to me. And I literally had the experience, of saying goodbye and them saying goodbye and then recovering and then literally them not knowing what to do because they had already grieved me. And I'm sharing this just because I don't think it's talked about enough. I don't unfortunately have any helpful tips on how to deal with it, but if you do for me, I'm all ears. Because I literally went through probably a stage of, well, maybe not a year, but quite a long one where I felt guilty that I didn't die. because I was like, I put everybody else through all this, and they made me a priority, and they spent the time, and they did all this emotional work, and we expressed all our gratitude, and we said our goodbyes, and then I'm still here. And I had like 2 people who were like, I'm thrilled you're still here. I'll do that, every day if we have to. This is a gift. And everyone else literally like disappeared. They were just like, I don't know. I thought you were gone. It does not compute.
That's so crappy.
Yeah.
Ugh. And Scott says, yeah. This is a phenomenon in the AIDS crisis, survival guilt. I'm sure there's research on it. Oh, for sure. And I'm sure you connect with other people who have similar diagnoses. You know what I mean? And you see, or, oh, this person has it worse than me. Or this person, they are having this, and it's like, it's almost a type of survivor's guilt. Yeah. And that is really, really, that's a lot to deal with. So I really think one huge thing to take away from here is encouraging all of your patients in any way who are experiencing a chronic thing to go and get mental health services, because I feel like most of these conversations are coming back to that of like, this is a lifelong thing that you have to deal with. And then from a patient side, like, please try to go out. And I know Melody's talked a lot about different types of therapies, and we're going to talk about that in a minute, of just like things that you can do to help get through stuff, because it is hard. And Barb says, thank you so much for talking about this topic and talk. I'm a nurse, but I'm also a mom to a 30-year-old who has debilitating endometriosis. Life and dreading pain and disability every month. That is hard. That is hard. Charles said, I do find it odd that the measures we take to make our pets to not suffer and have a quality of life are frowned upon if applied to human beings. I too find that very odd, that we treat our pets better than we treat our people a lot of times. Scott said there's a loss of function, and then there's the experience of losing function. And that is hard to watch it slowly go.
It's hard on the person to which it's happening, and it's hard for the people who are witnessing it.
For sure. Which goes back to kind of communicating about that. I know this is changing for you too. Like me, I can't do the things that I used to do. I can't, we can't have that same relationship. So it's changing so much. How are we going to navigate that? And working through that, and all of that. Anything else you really want to talk about before we kind of go into therapies surrounding just like coping skills and all of that type of stuff? Because I know that's where we're going to. We have a fun little Melody has a treat for us at the end, but we're going to wrap up with that. If you have any questions for her.
Actually, if I can do one thing first, and then I will take questions.
Type your questions now, and then we'll get to them. If you have any questions for Melody about like living with this, and we'll pick whatever she feels comfortable answering. I volunteered her to answer questions.
Okay. So just again, just having to do with the relationships and the communication. I know a lot of times people are trying to be respectful, and they're like, well, I'm not going to talk to you about my problems because you're already dealing with so much. And my response to that is, one of the only things that I have left right now is my ability to listen, my ability to give input, my ability to be empathetic. Don't take that away from me. I'm not dead yet. You're not burdening me. Still let me be your friend. And I just think that's really important.
And kind of like that whole mentality in general, like not always having to treat me like I'm not dead yet, like let me, I am not this super fragile flower, like,
Exactly. And then just have the discussions. Like I have a friend who, even though she can rarely attend anything, she always wants to be invited. It makes her feel good to be invited. I'm the opposite. I'm like, I know I can't go, so I don't want to be reminded of that. So just have that little conversation without me. Have those dialogues. Don't be afraid of them. It's much more in the long run. It's much less painful to have the conversations than to continue to unknowingly hurt each other just when you think you're trying to protect each other.
For sure. So selfishly, we are kind of talked a little bit about like things that you would just wish people in healthcare would not do if you
Mhm,
constantly interact with the healthcare system,
mhm,
other than like reading charts and like using our brains to critically think and be like, oh, yes, okay, I won't ask about periods if we don't have the period maker, like things like that, or a
mhm.
family member, things like that. Is there anything else that you just wish people knew? Like little things that's like, hey, just like maybe don't do that or say this a different way or approach it a little bit differently.
Basically, just again to be aware that there's a lot that you don't know, and you don't know the totality of the circumstances, and you don't know how the condition that you're treating or anything that you might say might impact them in a way that you completely did not intend.
Mm-hmm.
And to be open to having a conversation if you do see your patient, like watch the body language, and if you see them recoil or whatever it is, say, okay, I just said X, Y, and Z. I can see that you're feeling something. What's going on?
Mm-hmm.
And just help me deal with it then. I mean, I realize there's the time crunch and all
Mm-hmm.
that. But it's really important not to walk out carrying that and not knowing where to go with it.
Mm-hmm. And I think that brings up a good reminder that I was going to mention was your patient's usually the expert in a lot of their chronic healthcare conditions, or their input is invaluable because they have been living with it for 30 years. And you have not. You know what I mean? Like, especially if it's a more rare type of thing or the parent of someone, like those parents were like, I worked in peds a lot. So like those parents knew so much more about the anatomy of the heart and like all of the different things, like, and what their kid couldn't do. So just like listening when people say those types of things, you know what I mean? Like they have lived with it. Just listen. That's very, very
Yeah.
helpful.
And the other thing is, and this obviously doesn't apply to me, but if you have a patient who is silent, don't assume that means that they're okay with everything.
Mm-hmm.
Go ahead and ask questions.
That's a good, yeah.
Yeah.
You might just be so overwhelmed or just resigned. You know what I
Mhm.
mean?
Mm-hmm.
And you're just like, I just can't. I just can't. And that's, yeah, body language, like nurse mama said, is very, very important. It's always good to get input from the patient plus family. Yeah, especially if they have family there. That can be helpful. What does this actually look like? You know, 'cause sometimes I found even in patient situations where the patient, if they bring someone with them, the patient won't say how bad it is. You know what I mean? And that's
Mm-hmm.
when you can kind of like, but we've talked about this line before where it gets hard because you don't want to like overly involve other family, other people that are there, like, because then it can get all sorts of messy. But I found a lot of times people are like, the patient won't tell me, it's the patient's wife sitting there who's like, he can't stand.
Mm-hmm.
And you're like, oh, problem. Jacqueline says, thank you for such a great topic. Nurse here that has experienced some of what she has gone through. Thanks, Melody, made my day.
It's
Yes.
making my day too. Thank you.
And you guys can always find Melody. I'm going to link her YouTube channel down below, where she does all sorts of stuff over on there, similar to this, talking a lot about like music therapy, and it's wonderful. So go and check her channel out over there, because it's a delight. Alice said, also not applicable to me, but something with autism, please speak in an age appropriate manner. Don't talk like they're a child or only talk to the carer or family member. Yeah. You have a chronic condition. You are not deaf, unless you are deaf, but you know what I mean? Like, I feel like people usually talk loud and then they slow down
Kind of if
and
you
you're
speak a
like,
foreign language,
yeah,
people yell.
you were like,
Yell at people who speak a different language. It's like, no, this isn't a hearing issue.
yeah, you're like, yes, my stomach doesn't work. My brain is fine. Like,
Right.
yeah, don't even talk to children like that. Exactly. Like that's not even how we talk to children. So like what on earth? Nurse Corky, do you like it when your specialist asks your husband how he sees things with your illness? I'd be curious. And Barb says, do you know of any good dating sites? No. I would be curious, like what is there like I mean, that obviously has a huge effect on like dating, and you don't have to answer that or talk about it. But was that like a huge component of something getting like having a chronic illness at such a young age?
Definitely.
Yeah.
I never had a relationship that lasted more than 3 months. And they were, all really wonderful. They were good men, but I was just too tired to hold up my end
Mhm.
to have it be a balanced relationship.
Mhm. Yeah. And that's huge. And
I
that is
don't know
hard.
what they are now, but I know at least as of several years ago, there were some dating sites specifically for people with disabilities. So you can try Googling that.
Mhm. But that's hard.
Mm-hmm.
And that's a whole nother thing where we go back to, yeah, we have to look at like making sure, how do you work through that? You know what I mean? Like, how do you, if that's something that was desired, like your life's just going to look so different, you know,
Mm-hmm.
so different. Um, and see, Emerson says, yeah, my 12-year-old is autistic and I speak to him like a 12-year-old. Yes, I think we should do that more in life, is just, here we go. Let's do that. And Nurse Scott said I feel, yeah, being disabled can make you feel like damaged goods. And a lot of that is like Alice said earlier, we so associate productivity and like what you can provide to society with like self-worth. Um, you think the other person wants a partner, not a project. Yeah. And I would like, that is just really, really hard. Um, ugh. So as our segue from that that I just felt the need to bring it back as a downer. Do you want to talk about coping skills and things that have been helpful to
Sure.
give both people an idea of like, oh, this is something that's out there, but also like ideas for people like nurses, healthcare providers to offer? Because a lot of the times we're like, therapy, period. And like, we're talking like cognitive behavioral therapy. And the person's like, yeah, like, I don't really like talking about my feelings. And we're like, have you tried gardening? And they were like, yeah, remember how
Killed a cactus once. Yeah.
yeah. Or they're like, that's like, I literally like, I don't have access to, like, I can't, that's not accessible. That doesn't work. And you're like, well, you could journal, like, like our three ideas. And then we run out. And I know you have a lot of other excellent ones, if you would not mind.
Not a lot. They just work for me. So I think that the first step is to figure out what it is that you need from these therapeutic activities, instead of the other way around.
Mm-hmm.
And so for me, I have a huge need to just be what I call witnessed or heard. I don't necessarily need feedback. I just need someone to know that I am like so ecstatic that I got to be on Nurse Liz, or I'm so upset that I slept through karaoke, or that, I fell asleep during the concert, or I got to go see Dr. Phil. Okay. I know you don't like Dr. Phil. I don't like him now, but I liked him back then. When I lived in California, I got to see Dr. Phil, right? But I was so exhausted from the trip there, I fell asleep. I slept through the whole live broadcast. Okay, so anyway, I just want somebody that I can tell that I fell asleep during Dr. Phil and now I'm exhausted and I missed the whole thing,
Mm-hmm.
or I'm psyched that I was on Nurse Liz. And so for me, what I do is, and because of the issues around my eyes, I have an audio journal that I just talk into. And then my music therapist got trapped into being my mental health professional because there were none available. So I send it to her and she listens to it. And then unless I ask, she doesn't comment on it at all.
Oh, but it's been heard. Yeah.
But it's been heard. And I know it's been heard.
Mm-hmm.
She'll just be like, listened or heard or okay or whatever. And that's all. She'll talk about it if I want to. And I know she listens to them because she'll do stuff like quote me from like weeks before, or ask a question that there is no way she would have asked it, and this woman writes down everything and I don't know how she does it all. But anyway, so that helps meet my need, and she can do it at her convenience. I don't have to, she is paid for her time, but we don't have to, fit it into our schedule. And some people might have a friend that would be willing to listen for that, but it's like, that's my need. Some people have more of a need. Well, I have this need too, to be needed. Mm-hmm. And so in that case, again, it's having those conversations with your friends of like, hey, I'm here for you. You know, is there anything I can do for you? So it's not always like, what can you do for me? Mm-hmm. You know? So figuring out what your need is that needs to be met, and then work from there and be like, okay, if I need to be heard, then what can I do? I can do a broadcast on YouTube, you know, as long as you don't get hung up on people disliking you and ignoring you. You know, but if the need is just to vent, then hey, that's one way to do it. Or to do it in a tape recorder. Someone can listen or not listen. I mean, half the time I make these recordings and then I feel better and I just erase them because I heard myself, you know, or God heard me or somebody heard me, you know, just kind of figure out what you need and work backwards. Mm-hmm. Humor is a good one. And to find people with similar senses of humor. And a lot of time it's in the chronic illness community, I've found that it is a very unique type of humor. Mm-hmm. So you want to be careful.
Dark and twisty is what I like to call it.
Yes. You do that one. But figuring out, like, again, where are your boundaries? What are things that are not okay to joke about? Like, okay, I'm sorry, but that crosses the line, mm-hmm. you know, and just kind of, and no, and then otherwise have fun.
Yeah.
Know? Yeah. With, humor, I'm just really big, as I said before, on trying to bond over things other than the illness. And so, you know, most people I know have gotten into singing just because they met me and they didn't think they could sing before. Mm-hmm. And I was like, I don't care if you can or not, but you're going to try.
Yeah. This is going to be a bonding experience. It's going to be excellent.
I can do this, you know, so just things like that. And yeah, I don't know. It's a challenge because I'm a really big believer in, you know, whether you're healthy or not, it takes a village, and we are all so busy and so isolated, and that it's very difficult. Sometimes I will find myself, I have like 2 people who are really here for me that I'm fortunate enough that I can say pretty much anything to, but I will find myself complaining to them about the people who aren't. Mm-hmm. And I'm like, wait a minute. Don't waste their time on that, and don't waste my energy on that. Put my energy on the gratitude for the people who are here. Figure out some other way, like, you know, write a song about all these people who I really wish would change, and mm-hmm. you know, and do something else with it. But otherwise it does become tedious. It's like, I know you said that you'll help me all that you can, and because all these other people are failing me, you have to help me more.
Mm-hmm. It's like, we're usually the meanest to the people we're the closest to, because we know that there are safe people and they're not going to leave. Mm-hmm. So you're like, here's my inner dinosaur. Right. And you're like, why? Why? It just,
my daughter often doesn't feel heard because the mm-hmm. provider assumes so much
or minimizes
her experiences.
Mm-hmm.
How old is your daughter, Barb?
I think she said 30, right? With endometriosis.
Oh, okay.
Mm-hmm. Which just stinks. I feel like this happens all the time, and people just get blown off, and we throw it under like, oh, well, that's a mental health condition. Like, you know what I mean? It just gets like.
Oh, that's what I was going to say. Okay. So we've been having discussions in some of your other streams about nurses, whether or not they want to go forward in nursing, nurses, whether or not they want to stay in the field, and what options may or may not be available. I think, I don't know technically what the options are, but anything involving advocacy would be wonderful, because mm-hmm. not everyone can do what I do. I'm very articulate, you know, and I can write and communicate and figure out who's talking to who and who's not talking to whom about what. But most people can't. And frankly, sometimes I get tired, and I would love it if someone else could or would. Mm-hmm. So, and I know that sometimes depending on where you are, the palliative care can be a resource. The social workers can be a resource. I think I wrote down resources. I know that Nurse Scott suggested a few resources in another stream for advocacy. But I think that having a medical background and an understanding of the working of the bureaucracy and the system can definitely be channeled in somehow into helping individuals as like patient navigators or whatever you want to call them.
Yeah.
To consider.
And Mel too, like just having providers acknowledge when you don't know. It's totally fine to say you don't know. Like totally fine. It'd be weird if you knew everything, but I would imagine, yeah, from a patient's perspective, what the heck? You're like, why are you telling me all of this? Okay. Anything else you want to add? Questions? I wanted to make sure we got to all your points. I was like, perfect. You had so many good ones. And I was like, we need to get all of these in. She sent me an awesome Google. She's so organized. I was like, oh my gosh.
Only when I want to be.
Poor Melody trying to deal with me as I'm like.
Only when it's important. It's not important.
Alice said charities for certain conditions can sometimes offer information and support depending on where you are and what illness you have. So that's good and helpful to know. Yes, Scott, we would love to offer CEUs. Sounds like a second opinion problem. CEUs are continuing education units. I do wish this was like, this is the CEU stuff that I feel like we all need. Like actual things that actually can help our care. And instead it's like stupid stuff.
What is it that you've been wondering that you're afraid to ask? I'm here for it.
Oh, she's really opened it up. Dun, 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 dun. What questions do you have? I'm trying to think of what questions I have that I haven't already just like stuck my foot in my mouth and asked yet. I don't know. I'm pretty good at just asking awkward questions, and I'll ask my patients. I'm like, can I ask you this? Just tell me no if it's overstepping boundaries.
I have another good story.
Yes, always welcome good stories. Okay. Nonprofits here in the U.S. are often great resources. That's a great point, Mel.
So this goes back to something a doctor did right. She came up with the diagnosis, and it was a specialist. And she said, okay, so what we need to do immediately is we need to have an MRI, a CT, and something I'd never heard before. And I looked at her and I said, okay, I have a question. And she said, what? I said, well, if we do that, is that then going to tell us what we need to know, and then we're going to proceed with our treatments? Or is that just going to tell us the next battery of tests that I need to have? Mm-hmm. And it was a serious diagnosis. And so it was kind of like, we have to get on this and we have to get it now. And she was like, and I'm going to explain it to you, but don't look it up because you're going to scare yourself and all this stuff. And this can only be caused by 4 things. And these are the 4, and none of them were good. Okay. And so I looked at her, and this had to do again with communication and respect for the patients, because she was right into treatment mode and diagnostic mode. And I asked her that question, and she said, no, it'll just tell us, where we're at and what tests we need to run after that. And she said, and I said, and how long is all this testing going to take? And she said, well, honestly, by the time we get done with it, you may not be here anymore. And I said, okay, well then I would prefer not to do it. And she didn't argue with me. And she said, okay. And to be honest, I would make the same decision. And so, again, just respecting that and not forcing the treatment and feeling like she had to save me, but just informing me. I guess I would have preferred, in retrospect, something she could have done better was in the beginning to say, okay, so I'm recommending these tests, but just so you know, this is just the beginning. And laying that out instead of me having to ask about it. Mm-hmm. And then literally saying, I realize this is overwhelming, and I know, and in this case, she knows all my diagnoses and everything. I know the overview. Please charge. sorry, something wants to be charged.
I feel like that's my life motto. It's like, please charge. Please charge me. I'm so tired.
and so even to be given the option of like, I understand that you may want to think about this, or I understand you have been through so much that if you choose not to do this, that's okay with me. And if you change your mind at any time, please let me know.
Mm-hmm. And having a realistic discussion, having a realistic discussion of like, just because this is what the textbook says to do next, doesn't mean, like you said, like, does this make sense? Like for this person, like, what are you really gaining from it? You know what I mean? Like, what will we actually learn? Will we make different decisions based off of it? And explaining it that versus like, so just going that extra step and explaining, yeah, like, well, this is going to lead to that, which, oh yeah, like, won't actually benefit you. So why are we doing it? Because like Mel said, it's like expensive. You know, and all of this, we'll have a whole different conversation one day about the cost of everything. Cause how do you even afford therapy? How do you like all of that? Thanks mom. My mom sent me a super sticker. Aww. I appreciate you. It's a bird, ironically. She hates birds, but it's fist bumping people if you can't see it. So, thanks, Mom. The birds come and eat all her decorations off of her porch, and it's she doesn't love birds. As Catleg said, thank you so much, Melody, for opening up your heart and life to give us all a better understanding of what it's like to live with chronic illness. I appreciate both you and Liz. Thank you. Oh, well, thank you. That was sweet. And Barb Loftus said, Melody has such an encouraging voice. I agree. I'm going to recommend my daughter to check her out. I agree. Aww, I'm like, this like sounds so nice. I know it's been excellent, like so helpful to get to talk to you about this. And I've just very much enjoyed getting to know you as an internet friend. It's been delightful. So thank you so much for doing this and for always like showing up and being such a, I don't know, just a welcoming, encouraging voice in this space and for being willing to do this. I think it's been really awesome. And it's helped me a lot, reframe a lot of how I think about a lot of things. And I think it's going to help a lot of other people. I hope. Yeah. Alice said, sometimes it's hard to accept someone very young stopping treatment, but it's the best option. I recently lost a friend who was 19 to cancer and she stopped TPN and central lines because it was just best for her. Yes. That is hard. That is very hard, but yeah. And I saw that all the time in peds. And when the parents would say, stop, like, let's just be done. That was often received a lot of pushback. But there comes a point where you're like, let's look at quality versus like what we're actually doing. Here's a hard question. I find it hard not to feel like a burden. How to cope with that?
I think for me, I felt like that a lot too, just so you know, throughout my life. And I actually get upset with the mental health sites that say that's not true. Because I think that sometimes our situations are burdensome. And so for me, again, it comes down to communication and acknowledging that this is also hard on the other person and just kind of being like, you know, I know that you just saw me fall or whatever it was. And I mean, obviously not in the moment, you can't do it, but when you can address it, just be like, that must have been, you know, how did you feel about that? You know, are you okay? Or with a caregiver, I realize you've been here 3 days in a row. You know, do you need me to find an alternative for tomorrow? Do you need a break? And just to check in and just, again, just to acknowledge that they're people too. And that most likely if they love you, if they care about you, that seeing you in pain is draining and difficult for them. And they may not want to show you that because they feel guilty about it. And to just open up the discussion and just be like, hey, I really appreciate what you do. And I know it must be hard. And is there anything that I can do to make it easier for you to continue to be here for me this way? And by the way, given my limitations and everything you know about me, is there anything else that I can do for you personally? Because I care about you.
Mm-hmm.
Yeah.
I agree. Like, I think it's okay to acknowledge sometimes that as humans, we are burdens. You know what I mean? And
Mhm.
rather than like apologizing 12 times, like just like, thank you for being here. How can I, be there in a similar way for you in whatever way? I think that can apply to anyone in life because I think we're all really bad at admitting sometimes that we need help. Very, very bad at that personally. Mel says, in addition, Melody, for being a fab advocate, thank you to all the providers who are here and learning. Yes, thank you everyone who has. I always think we need more of these conversations. And Nurse Corky, yes, it is very hard to do. Okay, so to finish off our day, Melody and I are going to be doing probably next Saturday.
Mhm.
We didn't even talk about it. Okay, good.
All right.
It's like probably next Saturday at like a similar time. We're going to be doing another live stream on music therapy because that's something that has been particularly helpful for Melody in just a healing journey. It's helpful for a lot of patients. I think it's becoming much more common to have music therapy like in hospitals. So we're going to have that as part of our interview series where we're talking about a whole bunch of different careers in healthcare to try to open up ideas of like, so you're not like me and you're like, oh, you can be a nurse or a doctor. That's it. Like there's a lot of different options. So this is going to fit into that one where we talk about being a PA, working in palliative care, being a NICU nurse, all of that type of stuff. And if any of you work in you can just go to the playlist and see what specialties we haven't covered. Nurse Scott's going to come and talk about working in the ER. Vanessa doesn't know it, but Mama Nurse, I'm probably going to try to pick your brain about working in like your ICU, all of that, just so we have different exposure. So this is going to fit into that. And so here we have a question from Barb. We'll answer that and then I'll let you take off or explain kind of your intro to that. Hospice feels like a focus on dying. What would a health specialty be the focus on end stage living, feeling creative? Oh, we'll have to think about that. Because that kind of is, yeah, that's a good question.
That's that line between like palliative care sometimes and hospice. I think it depends on the provider. I know that there's a relatively new specialty that has to do with what they call death doulas, which are somewhat controversial, but I'm very much in favor because they will have those kinds of discussions with you at any age.
I think it's great.
Yeah.
I feel like we're so afraid of death. Like we are so afraid of it and we all do it. And we just don't love to talk about it. Mama Nurse, yeah, I think it's called palliative care. Yes, we just need a better name for it. We need a more fun name than hospice and palliative care. Okay, so would you like to talk about music therapy very briefly as a intro to what we will see? And this is going to play, we're going to play some music at the end. So we'll do our like little sign off here. In case, and then you can, in case we don't come back after the end or whatever happens. I haven't really planned it out in my brain, to be totally honest. But if you did find value in this, let Melody know, leave her a lovely comment. It's always wonderful when you've given your time, which she has here very generously given her time to us to just share her experiences, to be able to then go and read nice comments. Okay. Who doesn't like reading nice comments about themselves? So leave a lovely comment about Melody and how she is changing the world. Like the video, because again, it's probably not going to be able to be monetized, which again, that's not the issue. It's that YouTube.
But there's some copyright issues because she's kind enough to incorporate the music therapy.
But YouTube doesn't like spreading videos that they can't they can't put ads on. So if you like it, it tries to overcome them. So just do compressions on the like button an odd number of times and it saves the video's life. And if you are a channel member, remember on Monday, we're talking about that case, kind of going over the ethical side of who should be able to, like, can you have a nursing license if you're also doing shenanigans? Like, why aren't we investigating that more? So be on the lookout for that. And I think we have all the things. Okay. All right, friends, I'm going to hand it over to you and stop blabbering now. Thanks for being here. I appreciate you.
So yeah, next week we'll talk more about the various forms that music therapy can take. But for me personally, it has been mental health treatment and literally finding my voice and that need that I talked about earlier to be witnessed and to be heard. And I was offered a music therapist by a social worker, kind of by accident, and due to the fact that I couldn't find a mental health professional. The one that I see generally works with children or people with developmental disabilities. I am her only, quote, mental health music therapy client to my knowledge, and it's worked. So one of the exercises that I have found to be the most useful is to find an existing song and write my own lyrics to it. And then and sometimes those lyrics relate to the song itself, and sometimes it's just I like the tune. But it's helpful to me because I also write my own music. But I started this because it gave me a framework. Here's how many lines there's going to be. Here's the rhythmic pattern. Here's whatever. So I just wanted to give you kind of a sample of one of those, and we'll be doing a lot more next Saturday. If you enjoy this, hopefully then you'll tune in. And so I think the best way to do it for you to understand my process is for us to first play the original song and then play my version. And so then you can see what I've done with it. And,
Yes.
and Liz will be leaving the links in case you need to leave now or you want to check it out again later or something because you're not sure what I said or something.
Mm-hmm. And I was even thinking I'll probably play just a little clip of the real one because I think most people will know the song.
Okay.
And that way they're forced to listen to you sooner so they don't leave.
Oh, okay. All right.
Does that work?
The song, yeah. Okay, I try. This is your stream.
I was like looking at it. I was like, wait, no, I don't want people.
But
I was looking at it. I was like, I don't want people to leave. I was like, so I think they'll get the gist if we play like a couple seconds of it and then we'll just go to yours because I'm excited about yours.
Okay. Yeah, sure. And then you can leave the link and they can go back and play it if they didn't know it. I'd never heard this song until I went to karaoke like many years ago. And because I was into classical piano, but as I said. Okay, so this song is If I Die Young by the band Perry. So she will play the first version of it, and then I'll say a little bit about what I did with it, and then you can play mine.
It's very bold to assume that I'm going to be able to figure this out.
I left you the link.
I have it open on my computer.
Oh, okay.
Don't even worry. All right, it should be sharing audio. Let me know if you can hear it.
If I die young, bury me inside.
That song. Okay, yes, I've heard the song before, and we'll lean to the whole thing. It's that I die young, bury me. It's very pretty. So here is an even prettier version.
So what I did was I took this song and I made it about how I want to be treated now and how we should treat each other now, and also how I wish to be remembered later. And I call it From This Day On. And this is an excerpt from my music therapy session where my music therapist is accompanying me on the guitar.
And I love it because I like that you said that it gives you a framework because I struggle with that. So obviously it's not about me, but like it gives you a framework to work within. You know what I mean? Which I love. Okay. Let me know if you can hear it.
This is.
And thanks for sharing it with us, Melody.
Sure. From this day on, love me with compassion, surround me with the scent of roses, come and say good morning at dawn, serenade me with the words of your heart songs. Ooh. I'll soon be a rainbow, I'll rain sacred tears of colors on all of you who love me and on so many others, on all of those whose lives aren't as they ought to be. No, the bullied teen, the bruised baby, sundial for each life. Well, we all live in our own time. From this day on, love me with compassion, surround me with the scent of roses, come and say good morning at dawn, serenade me with the words of your heart songs, a sundial for each life. Well, I live in my own time, and I can see a rainbow. I wonder if it's heaven. Looks just like the music I learned when I was 7, and I'm still working hard to try to understand just what I can do and just what I can't. And the clock tick-tocked as I sought love forever, but here there's no such thing as forever or as never, just a sundial for each life. Well, I'll go in my own time. Hanging out on a rainbow, a bridge between worlds. I'll wait here till my sun dies down. A penny for my thoughts, oh no, I'll sell them for $1. Why are they worth more after I'm a goner? And maybe today you'll hear the words I've been singing. Why'd you wait till now, till you chose to listen? When my time comes, gather with compassion, fill the air with the scent of roses, bathe in the river at dawn, sing me away with the sound of my heart songs. Ooh, I'll sing from above, serenading you with peace and love. Release all your tears, I'll bring them where I'm going. I'll keep them safe, I'll be your angel, I will bless them. Oh, the sunset on my life, and I had just enough time. So sit under my rainbow, a bridge between worlds. I can't hear you, Liz.
I said, thank you for letting me, I muted it because my children were talking to me. Thank you for letting us play that. I think that was super amazing and beautiful and just like very vulnerable and special. And I appreciate you.
Thank you.
That was awesome. I think you have a wonderful gift there. And that is such a cool thing to get to share with people. And you can all go and watch all of her things if you would like to over at her YouTube channel, which we will link down below. And it's a whole bunch of that and just it's goodness. I mean, it's just great. So I appreciate you. Anything else you want to finish up with, Melody?
I just want to thank you, Liz, and everyone viewing this both live and in the afterplay, because you've given me a great gift. And you know, when that time comes for me and I'm looking back, I'm going to be thinking about seeing all of these comments and just the beauty of the group that you've assembled here, Liz, and it's very special to me, and I thank you all.
Well, thank you so much. I think you've given us so much, and we're so grateful and appreciative of you being here. And we're going to enjoy all of that. Yes. So thank you for being with us and doing all of those things. And yeah, going to not try to cry.
Well, she's asking how to connect with me. So if you're on Twitter, I know Nurse Liz will put it up there, but it's at the word twirling, the number 4, the word joy, followed by the number 1 is on Twitter. And my channel is there, but YouTube doesn't let you message anymore. I don't mind giving my email address. Liz, if you just, when you put it write everything down, you can include it. It's that twirling for joy again, the word twirling, number 4, the word joy at gmail.com. And that's me, Melody.
Perfect. So second opinion, get that down. And so everything will be in the description.
Oh yeah, I can.
Rachel will make it happen.
I'll type it in the box.
If you put it in the private chat, then she'll put it right in there. Perfect. All right, friends. Thank you so much for hanging out today.
Yes, thank you for spending part of your Saturday with us. I mean, that's amazing to me.
Yes, we so appreciate it. I hope I learned a ton. I hope you learned a little, took some nuggets away, feel less alone. And I hope you remember that you, my friends, are not alone. You are more than enough, and you can do all the hard things.
Okay.
Bye, friends.
Thank you.
Let's find the end screen. Here we go. One day we'll find it. Bye, Scott. There's Corky.
Oh, I'm waving.
I know. Cat leg.